Welcome to this 4-part introductory webinar about the UroDapter. My name is Bela Köves. I'm an academic urologist and the Chief Medical Officer at Urosystem. The aim of this webinar is to provide a comprehensive summary of the use of UroDapter for medical professionals, distributors, or interested patients. The webinar is structured into 4 chapters. We begin with the fundamentals. What is the UroDapter and what are the principles behind this innovation? In the second chapter, we continue with a very practical visual overview of how the UroDapter works. Following that, we cover the most important medical indications where the UroDapter can be used. And finally, the fourth chapter addresses frequently asked questions regarding the use of UroDapter. So, what is the UroDapter? There are different diseases or medical conditions where doctors give some medications or drugs directly in the bladder. This approach is called intravesical instillation or intravesical drug delivery. Traditionally, we used standard urethral catheters to deliver such intravesical instillations. However, catheters were never designed for this purpose. The main indication of urethral catheters is to drain the urine from patients, either because they have an obstruction, like it happens sometimes in elderly men, or they are in no physical condition to spontaneously empty their bladder. And for this purpose, catheters are well designed and a necessary choice. But for intravesical instillations, in patients who are capable of spontaneous healthy voiding, there is just no need to push a catheter, basically a rigid tube, through their urethra, and the only reason we used catheters was the lack of a better alternative. So, what are the problems with catheterization? When we insert a catheter, there is always a chance to cause urethral lesions or microtrauma, which can lead to urethral strictures in the long term or cause bleeding in the short term. With catheters, we can transmit uropathogenic bacteria in the urinary tract, leading to symptomatic urinary tract infections. And from the patient's perspective, catheterization is an unpleasant, often painful experience. And even if the catheterization is not painful, there is always the psychological distress before the procedure, the fear from the pain, which is often worse than the procedure itself. So, what could we do to solve these issues? The solution is the UroDapter, a urological syringe adapter designed to deliver intravesical or urethral instillations without a catheter in both male and female patients. With UroDapter, we can avoid causing urethral strictures, there is significantly less bleeding and infections, and the instillation becomes completely painless. Therefore, patients will experience no fear before instillations. Furthermore, it's an easy and quick procedure and allows the simultaneous treatment of both the bladder and the urethra, which is not possible with a standard catheter. The UroDapter is a CE-approved, FDA-registered Class 1 medical device. It has 4 main parts. A short, rounded tip. This is the only part entering the urethra to a depth of only 6 to 8 millimeters. Then there is an isolating collar that creates a watertight seal and closure around the urethral orifice, ensuring a leakage-free instillation. This is followed by a ribbed handling grip for easy manipulation and a connecting tail that is compatible with both Luer slip and Luer lock syringes. As you can see, the UroDapter is a simple yet highly innovative and extremely useful medical device. Thank you for your attention. See you in the second chapter, where we will review how the UroDapter works in practice.